Hi, everybody. I hope you're having a good weekend. And I understand there were some issues with audio with the video that I made yesterday, and I've been trying to work with it to fix it, but I can't figure out what's wrong with it. So I'm just going to make another one. And let's see. So we're going to go over 662. Now remember, I have two sections, 138 and 139 of 662. And we're going to go over the expectations for this week. I know everybody is anxious about these upcoming videos, so I'm going to go over exactly what the expectation is. I've taught physical assessment many, many times in the past. It's the first time I'm teaching it online, so I understand your concerns about the video portion of it. From my understanding, you submit it, and then I get a link to it, and that's how I observe it and give you your feedback. So we'll see. It'll work out. So let's look at our week 2. So we're beginning week 2 tomorrow, and we have our overview. Our devotion is first. And now, our first week, we're going to discuss cardiovascular disease. It's a leading killer of men and women among all racial and ethnic groups. And performing a cardiovascular assessment is incredibly important on your patients. Um, what I'm seeing a lot in clinic are patients being put on antihypertensive medications at a much younger age than usual, um, which I think is a great thing because research has shown that the earlier you start treatment, the long term advantages are definitely apparent. And of course, um, factors associated with an increased risk in cardiovascular health is high blood cholesterol, smoking, diabetes, hypertension. So, a cardiovascular exam should be a part of every focused and comprehensive physical assessment. And this is something that I do on every single patient, um, barring someone who's coming in for something like pink eye. I don't really care so much about their cardiac status, but it's very important, and it's very important it's done properly. Okay, so let's go here. So, our objectives for this week is your being able to demonstrate a comprehensive primary care physical examination on a primary care client, document health history, health risk assessment, and physical examination findings for a primary care client, and formulate a problem list. Your first reading is your Bates book, and Bates is an excellent resource for you. I actually used the Bates book, of course, a much older version, in 2002 when I was in my nurse practitioner program. We have some tools here also: heart attack risk assessment tool for estimating your 10-year risk of having a heart attack, and the Framingham Heart Study. So I want you to take a look at those also. Content presentation, we have the Bates Visual Guide to Physical Assessment, Chapter 9 and 10, Video 1 and 5. So take a look at those. I have had so many students ask me if there are example videos, and there are not. There are not any example videos, and I understand where you're coming from. I am in my doctorate program. I love to have an example paper so that I can at least have an understanding of the structure. We don't have that. So the structure you're going to find for this is in your rubric. All right, so let's go to this one here. I'm going to open up your assignments. And this one is your videotaped physical examination of the chest, heart, and lungs. So let's see what it says here. Using the process and procedure for the completion of a physical exam of the chest, heart, and lungs from Bates. Select a volunteer client and complete the videotape yourself, completing a physical exam of the client's heart, chest, and lungs. For the 5 physical exam videos to be completed during the 5 weeks of this course, there must be at least one child. That's going to be week 4 with abdomen, One female adult who's pregnant or who simulates being pregnant in week 5, and one male adult, and one older geriatric person. The final complete physical exam video must be completed on an adult. Throughout Bickley are examples of how to document physical examinations of the various body systems for an adult male, as well as a complete documentation for a child, a pregnant woman, and a geriatric person. So, this is where I want you to look and see how you would document physical examinations for various body systems. So, we're doing chest, heart, and lungs. So, if you look in Bickley, you should be able to find what needs to be documented. Okay? Begin the videotape by stating your name and what physical examination you are about to demonstrate, and have the client say that they agree to be videotaped for the demonstration. This client may fictionalize the information given, so make up why they're there and all that. That's okay. Use the rubric found in Appendix D, Physical Exam Documentation, Demonstration and Documentation, Chest, Heart, and Lungs. Explain verbally what you're examining and how you're doing the examination as you're demonstrating the exam. Describe what your findings are as you demonstrate the exam. You may fictionalize the findings as you describe them. The video can be no longer than 10 minutes, but I've stressed this in the very beginning. I would prefer it to be 5. And in order to do this, you need to have it very clearly stated. I would practice this multiple times before you film it, and maybe even write down what you're going to do and what you're going to say before you do it. Anything, and I'm going to be timing this video, so anything after 10 minutes is going to be stopped, and it will not be included in your grade, so it'll be as though you didn't do it. So you do not have more than 10 minutes to do this. Submit the video per the specific directions in the course of the course faculty and their directions for doing that. Professional dress is required during videos. Lab coat is preferred. Treat this video as though it were a true patient visit. Patients do not need to disrobe, of course, but I would suggest they wear like a tank top and shorts when they're doing these exams. FMP students may want to buy these, except perhaps the Doppler monitor, which may be borrowed from a local institution, maybe a doctor's office, a friend. If you work in the hospital, perhaps the OB unit will let you use one. Please check the rubrics to determine if any additional equipment items are needed for your assessments. The more expensive items that are listed below, and I don't think you want to go out and buy anything like otoscopes. If you live near, I can speak to the Oak Brook Center because I've taught there before. They have in their sim lab a corner that is made specifically for NP students. You can go there and film it if you want. It's ideal. It has all of the equipment. It's set up. If I were a student, that's what I would do. You need to call and set up an appointment, though. You can't just walk in. So you need to call up and set an appointment so that you can have access to that area of the lab. And it states you may contact the virtual learning coordinators to make an appointment to continue to make your video. Okay. And let's click on this and see what it says. It's not opening. Oh, you can make your video at home too. That's approved. All right. Stethoscope, ophthalmoscope, reflex hammer, tuning fork, Doppler. Those are things you're going to need throughout the whole course. Look in the files for instructions on the 5x7 prompt cards, which you can make. And those might be helpful to you when you're doing your examination. After you receive a grade for your video, it's important for you to delete it from the recording device. If you are found to have posted this anywhere, Facebook, YouTube, you will be separated from the institution. All right. Use only initials to identify your client. Document and chart the physical finding exams from his chest, heart, and lungs, along with the identification of any health problems or potential health risks, and submit it in a Word document per the specific directions of the course faculty. Include in the documentation the number of hours spent reviewing the exam procedure and practicing the physical exam process. Remember to listen to Herb's point. All right. Now let's look at Appendix D because this is the rubric that I want you to follow because this is what I'm going to be looking at as I am viewing your videos. All right, so let's look at this. Okay, Appendix D. Begin the video by stating your name, go through all of these things, and these are all of the steps that you're going to have to follow. If you do not follow, you will not get the points. If you don't do it appropriately, but you do it, you'll get half credit. So you've got a lot of things that you need to cover here. And you know what I do with my patients in the setting when I'm actually checking for these things, and I do lots of physicals. So when I'm doing a physical, it's incredibly important for me to do a complete cardiovascular assessment of these patients. I explain to them what I'm doing. And I say to the patient, oh, now I'm listening to the aortic region, the pulmonic, Erb's point, tricuspid, mitral valve. This is where I can hear things better. So, and I explain to the patient when I have them, because I always check the heart in 3 different positions. I'm listening because I can hear the mitral valve better when you're leaning forward. So use that manner when you are doing your examination. Okay? So this is the rubric. Make sure that you complete all of those things. And believe me, I used to do these assessments in the laboratory in Oak Brook. And the very last thing my students had to do was a complete head-to-toe assessment. And so a complete head-to-toe assessment is a lot more inclusive than just doing the heart lungs. They always did it in 10 minutes. Very rarely did it take longer. Sometimes it did, but most of the time it didn't. All right. Process for uploading to video.olivet.edu, so follow that. And you also have your rubric here that you can see. I would pull up the document and print it so that when I was devising my script, this is how I would do it. I would write a script. That's how I would use that for my scripting. Okay, I'm going to move this. All right, let's go to next. And let's go to next again. All right, now our discussion for this week. And there was a lot of confusion with discussions last week. And so I have 2 sections of the class, and the 2 sections are doing them differently. So one section is going to be using the discussion groups, and the other section is not. So if you are utilizing discussion groups, and let me get my course so I can get that course number down, 138. 138 is using discussion groups, and 139 is not. So 138, you're going to do it just like we did it last week. And 139, I'm going to go into that course so that you can see it. And then modules. For week 2. Whoops, I didn't want to do that. Okay. So here's the discussion, and I've already put this in here. I'm not putting 139 into groups. And in many classes, I don't put students into groups. And it works out just fine. So, in fact, I kind of prefer it this way. You have more people to look at stuff. And so I want you to individually, and when you see the term individually, that means everybody has to do it. Individually search online for information and or an assessment or screening tool that would help a primary care provider in the assessment of the chest, heart, or lungs of a client. Share a description and link to the information or tool found on the discussion board. Now, forget about the learning teams. We're not doing that. Now, each student is going to have to answer these three questions. Would the information or tool be valuable for a primary care practice? How could the information or tool be used in a primary care practice? What are the limitations of the information or tool? Okay, now what you're going to do is you are going to look at your classmates' tools. So they're going to be posted to this discussion link here that I've just put up here. Okay? You're going to look at those and you're going to answer these three questions. Now, you're going to answer these three questions. You can do it to one individual, or you can answer the question one to one, and number two to another one, and number three to another one. That's fine. Whatever you choose to do is fine. However, if someone has answered the questions on one person's post, another person cannot answer to that same person unless everyone has been chosen. So I do not want 5 people choosing the same person to answer these 3 questions to. If you do that, you will not get credit. So what I expect you to do is go in and answer those questions to someone who has not had a post put on there from anyone. And if everybody's been picked, then you can go ahead and choose someone that has already been posted. But it shouldn't work out that way because the way our numbers are, it's 1 for 1, so it shouldn't work out that way. I also don't want people using the same tools. In our last week's post, this group, about at least 7/8 of the class used discussion screening, or depression screening rather. And that's not what I'm looking for. I don't want you all to see the same tool because that's not going to be very helpful to you in practice. You may want to utilize tools that you use in practice now. If you work in ICU, I'm sure you've got some really good tools that you use, and that would be fine. All right? Now, what I do when I'm grading these things, there's a little thing up here called Speed Grader. So when I go into Speed Grader, I can see your main post and I can see the other posts that you've made. So that's how I do your grade. I look to see the quality of your main post, and I also look to see the quality of the posts that you've made to other students and any responses that you've made to other students. So that's what I'm looking at when I grade you. So I'm not trying to go through the discussion and find you here and here. Luckily, Canvas has that speed grader component, which makes it a little easier for me to do that. Okay? So I hope that you found this helpful. I'm sure that this week is going to be an anxious week for most people. But what I want you to do is then you get Thanksgiving week off, right? So you get to do this and you get Thanksgiving week off. You get a whole week to recover. I want you to practice, practice, practice. Make sure that you've got a clock there or timer so that you don't go over. And I guarantee everything is going to be fine. All right, so if you have any questions, please reach out. I checked the microphone, so we shouldn't have any issues today. And good luck.